Okay, peeps, this is the last segment of the muscular system. We are discussing the muscles of the lower part of the lower extremity as well as the ankle and foot. Tibialis anterior is the prime mover for ankle dorsiflexion. So that is when you're bringing your toes up towards your shin. There will be a series of extensor and flexor muscles, which should not surprise you. And I put in extensor digitorum longus because I want you to think about the name and tell me what it is doing. By this time, you should be able to figure out information about this muscle just based on the name. If there's a longus, there's a brevis. Digitorum stands for toes, and extensor means you're extending your toes. So sure enough, this muscle is going to be responsible for extending your toes. This gives you a very detailed photo of the dorsum of the foot. I shouldn't say photo, I should say image, done by Frank Netter, who's a fantastic artist. I would not put anything that looks even vaguely like this on an assessment and say, name this info. What I would like you to take note of, however, is that just as the carpal area has retinaculums, so does the ankle area. And the job of the retinaculums is to retinaculate, it's a correct term, is to keep the muscles flush up close to the skeletal system so they do not get damaged. There is a series of muscles, excuse me, that are on the lateral aspect of the lower part of the lower extremity. I learned them as the peroneal muscles, peroneus longus and brevis. There's also a peroneus tertius. More commonly now, they are known as the fibularis muscles because they are going to run alongside the fibula. So fibularis longus, if there's a longus, you betcha, there's a brevis. And that shows you all three of the fibularis or peroneal muscles. Moving back up a little bit more proximally, we have to talk about the hamstring group. The hamstrings, which I mentioned before, are biceps femoris that will insert laterally on the tibia, as well as semitendinosus and semimembranosus. Those will insert medially. You need to know these. You also need to make sure that you are not mistakenly saying biceps brachii if you are trying to name biceps femoris. I have had students do that. Throughout this system, you need to call biceps brachii by its full name, biceps brachii, and biceps femoris by its full name, biceps femoris. Do not call biceps brachii biceps muscle because you might get it mixed up with the hamstring muscle. Here's popliteus. That will be an internal rotator. I don't spend much time with popliteus, but I like its name because it tells you where it sits. Gastrocnemius and soleus are going to be important. They will insert on what is known as the Achilles tendon, which is now more commonly called the calcaneal tendon. They will allow you to plantar flex your foot. So when you see a ballerina or a ballet dancer, they're going to have giant, well-developed gastrocnemius and soleus muscles, the gastrocsoleus complex. If there's a tibialis anterior, it's going to be responsible for dorsiflexion. There will be a tibialis posterior, which will be responsible for aiding with plantar flexion. This just shows you the relationship between tibialis anterior and tibialis posterior. And that's it for now.